and good evening. I'm Melisa, Idris.
And I'm Sharaad, Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Tomorrow we will head into phase 2 of the movement control order, which will see stricter rules on operating hours put in place. Are these new restrictions due to the steady rise in the number of COVID-19 cases in the country, which currently stand at 2,766 cases? Have we done enough in phase 1 of the MCO to help flatten the curve? Now, we're going to be joined by the former Health Minister, Datuk Seri Dr. Dzulkefly Ahmad, in just a couple of minutes. But Sharaad, what thoughts do you have on whether phase 1 has worked?
Well, you know, there's so many different aspects of it. I'm not an expert, but what I've come to realize, Melisa, is that, you know, and yesterday when I took a taxi home, the taxi driver was well up on all the information out there on the COVID-19 crisis. He quoted numbers to me, and I was surprised by his ability to kind of pull all these facts.
Wow.
Now, all of us have these facts before us. It's the interpretation of the facts that I think is crucial, and that's why we're having Dr. Zul on tonight, as we've had many other experts telling us how to read those numbers. I mean, are those numbers, even if they're rising, are they rising at a rate that's in fact decreasing? So you can have deaths, you can get increased infections. That isn't necessarily a bad thing. It's just a question of the rate of those increases. That perhaps is where the real reading is. Yeah,
and also important because Dr. Zul is head of Selangor's Special Task Force on COVID-19, and as we've seen, Selangor has registered the highest number of confirmed COVID cases. We probably want to get an understanding of why that number has been so high. Is it just due to the density of population, or is it access to testing? We want to get all this information out there, and you know, as part of the conversation, also to understand the life after the MCO, right? Because it doesn't end. I mean, the disease is not going to magically go away at the end of this MCO.
Well, okay, this is the other thing, Melisa. A lot of us have come to accept, as we did initially, that there was going to be this 2 weeks of MCO. Then a week into that period, into the first phase, we had an extension. So the government signaled very early on there was going to be an extension of the MCO period. Now, everybody's thinking to themselves, okay, we've done 2 weeks, we have another 2 weeks left. But it's not quite school holidays, is it, Melisa?
No,
you know, because those things are fixed. The MCO period really is a strategy, part of a strategy in order to flatten the curve. And the expression that's being used over and over again. So if that curve does not flatten, or if we have an interpretation of the numbers that suggests we still need a nationwide restriction of movement, then it could be. We must brace ourselves for the possibility of yet another extension. That's not out of the question at this point in time, is it?
But also, it's perhaps not just an extension of the MCO, but rather, you know, rather than this being enforced, I guess civil society learning to live with the physical distancing. So to kind of incorporate that into our lives. And what that would mean is that our lives would change dramatically. Yesterday we had Dr. Jomo on the show with us talking about life after the MCO and after how our social interactions will change, how religious life will change, how political life could change, in fact. So we have to kind of just take this into consideration, and whether policymakers have considered those changes.
Right, and also, you know, so much of our lives are organized around, you know, mass meetings. We go for music concerts or theater performances. You know, the idea that somehow we would have to keep a 3-meter distance between each other at a theater production.
Well, I missed having you in the same set, with the same table.
Well, at least, you know, indeed. I mean, you know, our ability to interview people, you know, face to face, so on and so forth. But you know, because the one hope is that we do have a vaccine, and that at some point life will be able to return to normal. I think it's quite terrifying to think that you know, that life could change irrevocably for the human race.
All right. So we're going to joining us in the studio on Skype right now. We have Datuk Seri Dr. Dzulkefly Ahmad, former Health Minister and head of Selangor's Special Task Force on COVID. Good evening, Dr. Zul. Thank you for joining us. Now,
good evening.
There were 140 new cases of COVID registered today, including 6 more deaths. Now, can you help us interpret the numbers? Are the numbers showing a flattening of the curve?
Right. What we are doing for the time being is to, in fact, observe and sort of map out the day-to-day rate of change, yeah, which if you plot it on those graphs, it would only be able to show you how the daily changes by way of rate of change day to day. But in fact, if you are talking about flattening the curve, what you need to draw is not those kind of graph, but more importantly is to draw a on the x-axis, the linear day to day, but on the y-axis, you got to draw a log. You got to log the number, and then you can see when exactly will be the turning point by way of observing what is known as the flattening of the curve. I have drawn that. We have drawn that in our task force. You know, and I don't think it has been drawn anywhere else, even by J.P. Morgan or the Mir group and others. So yes, though you see, you know, sometime a differential of change day to day, but actually you will only get to see the flattening coming in as we now could observe in South Korea's case and China, where you can see it is flattened now. Yeah, but you cannot see whether you really get to have you got to the peak, or are you flattening? You cannot see that in those kind of graphical representation. As I said again, you got to do a semi-log plot, and we have done that, and I've tweeted that, you know, and I've got some response on that. That's the only way to show the flattening of the curve.
So, I mean, so simply put, Dr. Zul, are we moving in the right direction? Is that how you see it?
Right. I must say that as to the cluster coming from the UDA and the Khazanah person, and then the index cases on that, and then came the public group in the sense of another ascension, or rather another acceleration, where you observe a big cluster from that group. But now I must say that what is most worrying, if I may put it that way, is you see cases, confirmed cases now coming from non-related to those clusters, which is essentially coming from what we call as the sporadic cases, that is coming from the community transmission in the community, which is the sporadic cases which are telling you that the virus are around, and that you got to do more of testing and more of, you know, doing a lot more intensified testing, because it is no longer only associated to that two clusters, but as I've observed in our plot, that no longer for the last days or two. It's no longer from the public cluster, and that is now coming from what is known as the transmission in the community, which really is indicative of the fact that the virus are around, and it can be, you know, this is why you need to be granular, you get to be more detailed in getting information from MOH, particularly, not of patient identity though, but of information, clinical information. For example, day of onset of symptom, you know, day of admission or discharge, or whatever therapeutic or drugs that were used, you know, and all those clinical or the notes, clinical notes, right. You know, where you get to really be granular, detailed, so that you can really plot meaningful plots of identifying and geo-mapping, you know.
Dr. Zul, is this information being shared with you from the federal level? Because you are the head of the task force for the state level, for Selangor level. Is it being shared with you?
Melisa, you have asked me a very pertinent question. Much as we would want to, you know, that the authority share with us, we are not getting that kind of information, very pertinent clinical information. We want nothing of the patient identity, I must say again, their name, their phone number, you know, their age, whatever. I mean, not age, but, you know, things pertaining to their personal identity, because we want it anonymized. Okay, we want to have data relating to finally population, where we could do relevant analytics, pertinent analytics to really get to zoom into areas, just not district. We can micro-target all our testing, so in that sense, you will be more targeted rather than just blanket.
So if I understand you correctly, you're not getting that information. If so, why aren't you getting that information? What is the block?
I must say that there is a bit of a reluctance on the part of MOH. We give MOH the assurance that we are in no way interested in patient identity. Privacy, patient privacy by way of data protection must be observed, because we can't compromise on that. But what we are asking are just information relating to, relating to cases, the onset of symptom, because those are very important, the onset of symptom, discharge time or admission time or discharge, and some aspect of the clinical case in sense of what you're given by way of therapeutic drugs, antiviral drugs, and whatnot. So only those information, we assure you that this is in line with what is known as data protection of right. Patient.
Dr. So I'm going to get you to stay on the line, and we're going to take a quick break, but continue this conversation in just a couple of minutes. So don't go anywhere. Stay tuned to Consider This.
Assalamualaikum semua, kami Dayang, kami just nak pesan kita orang semua arah-arah time tu dalam situasi tu kita ikut arahan kerajaan untuk stay di rumah, jangan keluar, nak keluar pun atas urusan penting ataupun siapa dielakkan lagi. So, stay home, stay healthy, semua tu sebentar je. Muah.
Assalamualaikum abang-abang, adik-kakak di Sarawak. Kami Awang Nazim dari Astro AWANI ingin mengingatkan kita semua untuk patuh kepada perintah kawalan pergerakan yang telah diumumkan Perdana Menteri. Malah Ketua Menteri kita Abang Johari pun mana jangan keluar rumah.
Welcome back to Consider This. I'm Melisa, Idris with me, Sharaad, Kuttan, and we're speaking tonight to Datuk Seri Dr. Dzulkefly Ahmad, former Health Minister and Head of Selangor Special Task Force on COVID-19. Now, given what you've just said before the break, Dr. Zul, do you think that there can be an effective state-level response to this pandemic, or should the federal government have complete control in the public health response?
Right. It's a very, very important question for me to address. Firstly, I must say that at this level of the epidemic, or now a pandemic globally, it is so important to stress that it is just not about the Ministry of Health or any particular ministry alone. It is about the entire government, what we call now as the whole of government approach, and as well the whole of society's approach. So it must be an involvement and a participation of all. So you see how, for example, South Korea,
respecting the right to information and whatnot, you can actually see that that the basic strategy is openness, transparency, information to people, and in that way they really get to winning
public trust due to the free flow of information. So what I'm suggesting, what I'm alluding to, is the fact that it's no longer about MOH per se and alone, carrying this task. With all due respect, they have done very well. But moving forward, and to the volume and the monumental task of handling in the second phase of MCO, you require the involvement of what we call now WHO's term, a whole of government, all ministries involved, and a whole of society, both private, both the NGOs, the CSOs, and all. And already you can see them. So what we are in need of is actually what is known as perhaps we can term it as the coordination committee, where you get to see the involvement of all through a central coordination committee, perhaps by NATWA, perhaps by the newly appointed advisor to the Prime Minister on Public Health, Tan Sri Jamila, because only through this way that you can see orchestration and coordination by all and through all. And you hear how NGOs is buying PPEs and ventilators themselves, to Korea and to Taiwan,
right.
and this shouldn't happen at all.
Dr. Zul, can I ask you? Dr. Zul, can I ask you, in terms of the kind of golden rule that's often repeated of trace, test, and treat, do you see that the success of that over the last 2 weeks? What information, anecdotal or otherwise, are you getting to suggest whether we are in fact trace, test, and treating sufficiently? Melisa
asked me earlier on about the role of state government. We are all ready to partake and to enhance further testing. As you very well know, it's so important. Test is the WHO mantra to address this issue during this kind of MCOs, because the MCO provide this kind of respite. Okay, so to answer you directly, yes, we are seeing, but we still have a lot to do, Sharaad. We still have a lot to do, and I believe that not just the MOH, the volunteers. We have volunteers in Selangor. There are doctors who are with the cell care, and they are more than willing to get down to, of course, that Selangor is one of the is the top in the federation. So we want to help out, and we want to extend this help, and there must be, some facilities for us to get to doing it.
And on that note, you talked about frontliners, so people going on the ground willing to help to treat. Are we doing enough to help protect the frontliners in terms of making sure they have sufficient PPE and in terms of testing them for this early on?
Yeah, you are right, Melisa. What we need to do in Selangor is to get our volunteers to be tested first. So we are looking at doing a test of about 2,500, and we want to get our frontliners or volunteers to be tested first. Yeah, and I believe that frontliners must be given all the protection and all the priority, of PPEs, the gown, everything, the mask, and the gloves
do they have enough, Dr. Zul? Do they have enough?
Are you seeing shortages?
This is why I said the importance and the urgency to implement a central coordination committee that must be oversight or be overseen by either NADMA or a person like the newly appointed special advisor to the Prime Minister on Public Health, that is Tan Sri Jamila Mahmud. I think that's the way to go, because you can see these things are very fragmentized and things are going everywhere. So, this is why I think it's so pertinent and critical to have these coordinated.
Right. Yeah, Dr. Zul, we hear you on that in terms of your appeal. Let's hope that the relevant authorities answer it shortly. I want to ask you, before we go to a break, again, the question of communications. Is the message going out there about the need for the MCO to flatten the curve, about the need for social distancing, about the need for people who have been in contact to come forward? We've seen the reluctance of yet quite a number of people involved in that tablet cluster not coming forward. Do you think the communication strategy has worked?
Well, I must say that we are trying our best, and but of course, it is only seen in action whether social distancing is observed, and it's quite unfortunate when this thing happened by when some ministries were engaged in this kind of event that actually in a way, break the rules and the laws, and it's very unfortunate that shouldn't recur. Yeah, but more importantly, even in Selangor, the Selangor Task Force Committee first, the SDFC, the first thing we embarked was on awareness, was on the various guidelines, to business stakeholders, business owners, to eateries, and as well to the general public in all various settings, in the groceries, in the market and all. So yes, it's so important to be able to see on ground zero whether it eventually, cascade down all these good guidelines, whether it is practiced or not. So I think we got to emphasize more on awareness and observation of all these guidelines. It's not just good to have infographic, media, but on the ground, it's so important to not only, break the transmission chain, but as well to actually then, flatten the curve by doing two things. One is, of course, at the level of hospital management. This respite, this is a buying time thing, because you get to see how hospital can then, get to enhance further their capacity, and then you can see mortality rate being managed, and as well recovery rate being managed. I think on that score, I must say, is very commendable on the part of our performance, particularly MOH and the rest. But as well,
recovery rate, you mean?
Yeah, both recovery rate and mortality rate.
Okay, right.
The recovery rate is at, I think recovery rate is at 18%, and mortality rate is at 1.4%. Very commendable indeed.
Okay.
Yeah?
All right, we're going to have to take a quick break, Dr. Zul, and come back and continue this conversation. Stay tuned to Consider This.
Assalamualaikum semua, kepada warga Terengganu, rakyat Terengganu yang mungkin duduk di Terengganu ataupun duduk di luar negeri Terengganu. Jadi hamba nak minta kerjasama belaka supaya kita duduk di rumah. Jangan tubik, jangan keluar, jangan bawa anak-anak tu tubik jalan ke apa ke. Ini adalah waktu yang sangat kritikal, orang kata. Kritikal. Oh, payah nak sebut tau. Jadi duduk di rumah, buatlah benda-benda yang bermanfaat. Nak tengok TV ke, macam hamba petang ni nak buat benda ni, nak nyabik rupuk. Allah, tinggi belaka dah rupuk. Jadi inilah masanya hamba nak gunakan untuk nyabik rupuk. Selesai bang. Nampak? Clear dah sekarang. Okey lah, dok kata lah, sebab kita pakai gunting tau. Kita pakai gunting.
Welcome back to Consider This. Melisa and Sharaad here with you this evening. We're speaking to Datuk Seri Dr. Dzulkefly Ahmad, former Health Minister. Now, tomorrow is the beginning of Phase 2 of this MCO. Dr. Zul, how do you think things can be done differently or done better in this coming second phase?
Just before we left, I mentioned to you about the importance of getting our, these MCOs provide that respite, provide the buying time to get our kind of facilities, particularly our ICUs and all those by way of the preparedness to handle patients that are more severe and critical. That's certainly one aspect. And I said to you that earlier that by way of mortality rate, the CFR, the case fatality rate, and as well the recovery rate, we are doing well. Going by that, I must say that we are doing very commendably. However, on the second domain, which is the public health measures, so going into MCOs too, we have got to really be serious about this. That aspect of hospital base is one thing, the frontliners and whatnot. But on the part of the public health measures, these will really need to involve society at large, the rakyat, the citizenry. They must understand that they need not be implored or begged to come for testing or whatnot. They must responsibly, on their individual capacity and earnestness and honesty, come forward, because this is the only way, because what
Dr.
we need
Zul,
to do...
on that score, Dr. Zul, there's still talk about the tablet cluster. Have religious leaders failed? Is there a trust deficit with the authorities that people are still, despite all the pleas, despite the call for non-stigmatization of the tablet members, yet there is reluctance? What's going on? Tell us.
Well, I don't think it is as a result of a trust deficit to the authority, more than an unwillingness or perhaps a bit of ignorance on the part of our rakyat, our citizenry, to understand that they may be asymptomatic, but they certainly, as you very well know, 80% of us will definitely be infected. You and I could have already been infected, but we are among the 80% that will, be asymptomatic without any symptom. Without any symptom, cough, or runny nose, or whatever, of shortness of breath, and you may be asymptomatic, but they may not realize that they are in fact carriers. So soon as they realize that despite not having symptom, they cannot take that for granted, because they may not be themselves down with COVID-19 kind of disease, but pneumonia, like not the severe one, but they are certainly and definitely a carrier, transmitting this virus around. And they must understand, to the two extreme of ages, those above 65 and those below, the younger children, and they are the vulnerable group. Although children for the time being are not so susceptible to SARS-CoV-2, but I must say that if they get to understand what they have, what the consequences of their action of not wanting to come forward, I'm sure it's not that they are not less, it's not that for the reason of a trust deficit, but it's to me more of ignorance. Hence, the need to enhance further awareness.
Okay, so you're saying so increasing the education, increasing the level of awareness, and making sure that communication lands to everyone, right? Okay, well,
exactly.
Thank you so much for being on the show. Unfortunately, that's all the time we have to speak to you tonight, Dr. Zul. Thank you for joining us.
Thank you, Sharaad.
Thank you for joining us on this episode of Consider This. I'm Melisa Idris, with me Sharaad Kuttan, signing off for tonight. Thank you for watching, folks. Stay safe.